CDC confirms first severe case of H5N1 bird flu in the United States. Governor Newsom takes proactive action to strengthen robust state response to bird flu. What you need to know: following the spread of bird flu in 16 states, including in California and outside the Central Valley, Governor Newsom proclaimed a state of emergency today to further enhance the state's preparedness and accelerate the ongoing cross-agency response efforts. Sacramento, California. Governor Gavin Newsom today proclaimed a state of emergency to streamline and expedite the state's response to avian influenza A, H5N1, commonly known as bird flu. This action comes as cases were detected in dairy cows on farms in Southern California, signaling the need to further expand monitoring and build on the coordinated statewide approach to contain and mitigate the spread of the virus. The virus has spread in 16 states among dairy cattle, following its first confirmed detection in Texas and Kansas in March 2024. To date, no person-to-person spread of bird flu has been detected in California, and nearly all infected individuals had exposure to infected cattle. California has already established the largest testing and monitoring system in the nation to respond to the outbreak. This emergency proclamation will provide state and local agencies with additional flexibility around staffing, contracting, and other rules to support California's evolving response. This proclamation is a targeted action to ensure government agencies have the resources and flexibility they need to respond quickly to this outbreak. Building on California's testing and monitoring system, the largest in the nation, we are committed to further protecting public health, supporting our agriculture industry, and ensuring that Californians have access to accurate, up-to-date information. While the risk to the public remains low, we will continue to take all necessary steps to prevent the spread of this virus. Ongoing efforts to prevent spread and serious infection. California has mobilized a comprehensive cross-agency response to bird flu in dairy cattle and poultry farms to minimize farm worker exposures, reduce raw dairy product contamination, and mitigate the spread of the virus. The state has enlisted local, state, and federal government technical and operational expertise to support all facets of the response, worked to educate the public, health professionals, employers, and workers on prevention and control measures to reduce the risk of exposure to bird flu, provided comprehensive information for employers and workers on personal protective equipment, PPE, requirements, and distributed millions of pieces of PPE to high-risk workers at dairy farms. Through coordinated public awareness efforts between the California Department of Public Health, CDPH, the California Department of Food and Agriculture, CDFA, California Office of Emergency Services, CalOES, and other agencies, the state is leading a cross-agency response that includes timely public updates, multilingual outreach to dairy and poultry workers, targeted social media efforts to promote preventive practices, online and printed resources for the public, and media interviews to keep Californians informed. Additionally, the state is ensuring that agriculture workers have access to additional doses of seasonal flu vaccine from the Centers for Disease Control and Prevention, CDC, to reduce concurrent flu risks. Officials have also been working in close collaboration with the Centers for Disease Control, the U.S. Food and Drug Administration, the U.S. Department of Agriculture, and local health and agricultural officials, as part of a whole-of-government effort to coordinate, implement, and ensure timely surveillance and investigation of potential cases of bird flu. Bird flu in the United States. Bird flu was first detected in the United States, in the wild bird population in South Carolina in January 2022, and in the wild bird population in California in July 2022. On March 25, 2024, an outbreak of bird flu in dairy cows was first reported in Texas and Kansas, and CDFA took immediate action to monitor for bird flu infections in California herds. Since then, there have been 61 total reported confirmed cases of bird flu infection in humans across 7 states, including 34 reported human cases in California. On August 30, 2024, following its detection in 13 other states, bird flu was confirmed in a dairy cow in Central California, and the California Department of Public Health immediately activated its Medical Health Coordination Center. A copy of today's state of emergency can be found here, right arrow in description.